Now we have multiple immune checkpoint inhibitors that are used in combination. And when you combine these very powerful antibody treatments, you can increase manifold the complications that patients develop. As I mentioned, it takes the brakes off the immune system. So you have T cells, which are the soldiers of the immune system, fight cancer cells and control advanced stage cancer very well. But then patients develop all these complications. You can think of these complications as inflammatory responses in almost any organ system in the body. So neurologically, we're dealing with inflammation in the meninges, so meningitis, encephalitis, inflammation of the brain itself, inflammation of all the cranial nerves, of the nerves along the spine, and the connection between nerves and muscles, and the muscles themselves. So all of these areas can become inflamed, and patients can develop complications such as weakness, inability to walk, inability to talk, confusion. And that's the neuro part. But, when you talk about other organ systems, they can develop a rash, so inflammation of the skin, inflammation of the lining of the gut, so colitis, inflammation of the heart, so myocarditis, which is a particularly fatal complication in lots of cases. So, the scenario is such where a patient can come with myocarditis, along with myositis, inflammation of the muscles, along with myasthenia, which is inflammation of the connection, the signal between the nerve and muscle. When you have all three things happening at once, patients can worsen to the point where they lose strength of their breathing muscles and of their heart muscle. They can develop essentially heart failure and die. And that triple condition, so-called an overlap syndrome, because you're developing three different complications layered on one another. That particular one is not known to exist in any other setting. So it's a new condition, and is particularly with high morbidity and mortality. Patients can die, and we're still evolving in our ability to manage this worrisome complication. There are just, too many kind of syndromes to even mention within a few minutes. But, suffice it to say that, the suffix itis stands for inflammation. So if you put that at the end of any organ system, these patients get itises of all the organs. With other organ systems, kind of when you add them all up, large pharmacovigilance studies, like the one that I'm a discussant of, that the study was done on. We know that from these large vigilance studies and also clinical trial reports that the incidence is in the upper range of the 30s. So somewhere between 35 and 40% of itises affecting multiple organs. In the neurological realm, the complications of the peripheral nervous system is about twice as frequent as the central nervous system. And the maximum rate there is about 12 to 14%. And then central nervous system, about half of that frequency.